Hi everyone, we are going to talk about one of the most underrated medicine for cough and cold, that is your regular saline nasal drops. So any child who is healthy, has a good immunity, like the most ideal child, has had breastfeeding, has had no issues during birth, was a full-term baby, 3 kg baby, yet once he or she joins school or once he or she starts interacting with other kids, they will fall ill, generally 5 times a year, and out of which none would require admission as such. It would just be a short-lived illness for about 5 to 7 days, and majorly it's always cough and cold. So I have patients who come to me and they are just really fed up of me writing saline drops every time, but I cannot lay enough stress on the importance of nasal saline drops. See, the thing is that kids have a lot of post-nasal drip, meaning that the thick mucus accumulates in the nose and then gradually drips down and kind of causes a lot of throat irritation, predominantly because they are supine all the time, meaning they are like laying flat on their back all the time, so it all dribbles down. Secondly, they cannot effectively blow their nose, so that is number two. Number three is that they cannot really, if the cough is coming out, they swallow it back. So so various ways in which saline nasal drops will help you all. See, this is not a medical post, it's just for more and more awareness, so that we all are we miss explaining the importance of all this in our regular OPDRs, and hence the reason for this video. So one of the major reasons why kids also don't take feed in the newborn age group, probably the first 2 months, is nasal blockage, because if they are attached to the breast, the mouth is closed, and if there is nasal blockage, they will leave the breast all the time or leave the bottle all the time, just for the for taking some air. So if you're experiencing sudden change of refusal to feed, you can put nasal saline drops without even asking your pediatrician, because see, the thing is that it is very safe. Let me tell you about the contents of saline drops. It's just salt water, meaning namak water, meaning something which is very simple, very day to day. So all you have to do is just put 1 drop in each nose, and then of course if he or she again refuses for feeds, you have to go to your pediatrician. But certain things like this only happen at 2 a.m. at night, wherein no doctor is available, so it's always advisable for you to keep it at home. Secondly, in the newborn age group, it's easier. As the kids get older, they don't like it, so it's a 2-person job. Luckily, you have this nozzle, which you can put it right inside the nose. It is more important, many times patients tell me that the coughing increases at night. Are you sure the chest is clear? And so many times the chest is clear. The coughing is because of the postnasal drip, as I explained previously. So if you have any doubts related to this, you can ask me, and just be patient. You can use it 2 to 3 times a day too. It does not cause any side effect. Contrary to the popular belief, it will not cause addiction if you use it for, like, say, a limited time of about 4 to 5 days. Of course, this is simple saline drops. This is not oxymetazoline or other things which reduce the secretions. This just moisturizes the nasal cavity and liquefies the thick mucus, which causes the nose block. So this is different from other brands which is available. So if you have any doubt, again, you can let me know. See you all very soon.